Am I controlling?
We're live.
We're live. Good morning, everybody. Is it working? First of all, are we live? Can you hear me? Is there sound? Is Jesus watching? Does he also
We're
have
not
the
getting
wheel?
the all clear from Sadie just yet.
Okay, I know there's a bit of a delay. We got it! Yay! Welcome to Medicare Cafe. You are in the pre-chat section, so if you're watching the recorded version of this, you want to skip ahead a few minutes because you just want the deets of what we're talking about today, which I don't know how I'm not driving the bus. Which today what we're talking about is actually a topic that how do we, like, the things that are keeping you busy right now, like the client help stuff that's keeping you busy. So we'll get back to that.
Stuff.
Before we get on there,
So many little things.
If you do want to reach out to me and go back to, you're good. I can't drive it. It's not allowing me to drive.
Oh, it's not.
So if you, so today, this is my phone number. If you want to reach out to us, please let me know. And just shoot me a text because we're here. But Kari and I are really exciting because we're going on vacation together here and the end of this week.
Like days.
Yes.
It's like we could count in hours. It's so close.
I'm so excited. We're going to Hawaii. My first time ever.
I've been to Maui. It was years ago,
Yeah.
but I've never been to Kauai, and I'm really excited.
I'm very excited. And so we actually were talking about, because as everybody knows, Kari is a full-time mom while she's also being a full-time boss.
As are you.
For sure. And our kids are really close in age. You have the two girls and I have one boy.
Mm-hmm.
So we're kind of talking about like our, like,
just everything you have to do to prepare to leave them.
The mental load, right?
Is insane. Like the amount of to-do lists that I have.
I have more than I am too.
I have like a to-do list.
Tell me about
your.
I was gonna say, tell me about your spreadsheet.
Every day, no spreadsheets, just like 5 to-do lists. And I even made a to-do list for Glenn because I'm like, you have to do some of these things.
Mm-hmm, mm-hmm.
But yeah, there's just a lot to
do to relax, right?
Yes.
Like you can't just show up like again, my husband who builds houses, owns his own business, like maybe works a week out of the month. He'd kill me if he knew I said that about him. But like right now is the week that he needs to have
he
to
needs
actually
to be
work.
Working.
And he's like telling me how stressed he is. I'm like, I don't want to hear it, girlfriend.
Yeah.
Like you, like it's truly. And he's telling me like, yeah, I have to be at the houses Thursday day. I gotta be at the house that morning because we're leaving on Thursday.
Boo-hoo.
And I'm like, I'm still working half a day. I'm actually I'm still doing all these things.
Yeah.
And I'm like, so.
And we have to do more to prepare, like get our nails done.
Do our nails
and like that is the most important thing. When are we going to do that?
So many people don't care about this, but that is the one of the like. Is it like my son's going to take care of? Yeah, all of that I'm stressed about. The most thing I'm stressed about
is your nails.
Is when am I going to have time? Because I do my own nails. So when am I going to have time to do my nails? When am I going to have time to go get a
Wednesday
pedicure?
Night.
Well, you would think. But I also have to make sure I can fit up my workouts then because airports make me feel gross and I want to feel good.
You got to do it in the morning. That's what I've been doing.
And then
5:30. I'll text you.
Please
5:30. Get up with me.
There was a debacle this morning. That was the plan. Didn't get done. Okay. Then I had to figure out when do I get a spray tan, which also has a coordinate.
Don't bother with that.
My legs.
Just don't bother with the spray tan.
Listen,
it's like mom math.
That is mom math. When girl math meets mom math. Is when you go on vacation because it is stressful.
Don't get the spray tan, dude.
I have to. I don't have to.
Nobody's tan this time of year.
That's a me thing. Like I'll feel confident.
Do you know I've never gotten a spray tan?
You've never gotten a spray tan?
They scare me.
You should go get a spray tan.
I'm gonna do like I would pull like a Ross somehow.
Yeah, no, it's easy to do. Brian says the return of Medicare.
You missed me last week, Brian.
I know, Brian. What the heck? Where were you?
Here.
If you guys have any
Sadie, am I good on talking in here? Okay,
if you guys have any
I need to eat the mic, I was told.
Vacation rituals, like something that you have to get done before you leave your house for an extended period of time or before you go on vacation. Like my husband, him and I don't know how we got married. He has to have the entire house spotless. And I understand.
Me too.
I understand it.
That's
like you guys
me.
are my type A people.
Mm-hmm.
I understand it. It couldn't be me.
Yep.
No. Because when I get back, I'm gonna my suitcase is gonna explode. I'm gonna ruin it anyways.
There's just something about like leaving being tidy. I don't know.
Couldn't be me. If you guys have any rituals that you
have
to do,
why you're married to who you are and why I'm married to who I am.
100%. We complete each other.
That's right.
Guys, it is at the top of the hour. For those of you just joining us, welcome to the Medicare Cafe. You're joined by your host. My name's Olivia Richardson.
And I'm Kari Vogt.
And again, guys, this is my cell phone number. Text me at any time, even if you're watching the recorded version. I always try to respond. If you text me over the next week, you're not going to get a response. No. I am on vacation.
We'll be 5 hours behind.
We'd
still be asleep right now.
Yep. It's my favorite part of vacation. And you've already booked all your excursions.
I have.
I
did it a month ago.
I know. Again, you're my type A. The only thing I have booked is golf. I'm golfing, and that's the only thing that I have planned. And
I've got my snorkel cruise, the luau, and the kayak in the jungle to the waterfall.
I have so much anxiety. You're not bringing the girls.
No.
Yeah.
No.
Good for you.
Mom
I'm
and
not
Dad
bringing
time
my son
out.
either. Okay, guys. Today no
one knows how you got married.
Press 2. No one knows how you got married. 100%, Brian. I outkicked my coverage and then some. Today, guys, we are going to be talking about, again, it is March 18th, 2025. Today, we're going to be talking about what's keeping Kari busy.
My clients and all their little just problems.
Well, here's the thing. A lot of people.
There's so much that we do.
There's so much. There was actually one,
don't think about.
Colby, who you and I both know.
Yeah.
He made a video, maybe it was 2 years ago, on his TikTok or on his Instagram. And he was just like, here's the day in the life of an agent.
Yes.
Do you remember that?
I don't remember seeing it. Brian did one.
Yeah.
Too. But I don't know if it was going over specific client calls, because I feel like that's what I feel like I've been so busy the last few weeks.
Yeah.
And I'm like, what have I been doing?
Yeah.
And then I was like, oh, well, I had to call 75 different places to figure out where this guy was going to get his CPAP supplies.
Mm-hmm.
Because apparently in Illinois, there was several DME suppliers who just don't bill Medicare.
Just done, yeah. Having the client have to do all the back end work.
No, the DME suppliers say they don't bill Medicare.
Okay, so they don't accept Medicare.
Yeah.
Okay.
And I'm just because I have tons of clients over here that have CPAP machines, and I've never had any issues with them saying the supplier is having trouble with their insurance. But my client in Illinois, he couldn't fill he's a new client, and he went to get new supplies, and they're like, we don't bill Medicare.
So I have a question.
So then I had to keep calling around to find other DME suppliers in his area who bill Medicare, and 6 of the 5 I called, 5 of the 6.
There we go. I was going to say, you're better at math than that.
5 of the 6 did not bill Medicare.
That's wild.
Isn't that weird?
I haven't heard that as far as the DME side's concerned.
So weird.
So let me ask you this. We're going to kind of go over some of these things. Again, drug costs. You talked about drug grants. You were asking me questions. I'm like, girl, I've never heard of that. The income-related monthly adjusted amount, client IT issues, and just help me with these random things. Let me ask you a question before we get into it.
Okay.
Because when we look at, again, building a business, you got to be looking at revenue at the end of the day.
Yep.
Apps, and the only way that you, at the end of the day, can build more revenue is by turning in more applications.
Correct.
And keeping those applications on the books. Both of those, retention but growth in revenue comes from new apps, right?
For sure. Yep.
At what point, and there's no wrong answer, it's just a question if you're looking at the business side of what we do, at what point are you losing revenue by spending time on helping clients with these things?
Well, 2 of those bullets, they were new clients.
Yeah,
they're leads that I'm working with to get new apps in. And I feel like it's not always. It could just happen to be a few, everything's happening at once right now. Right. I don't know. I don't feel like this is.
Well, it's a question.
Always.
This is a question that I have, and it's not geared towards you. It's just geared towards the agent mindset. There is a lot of people, let's just take it. This is retention activity, right? Let's take it to new app activity.
Okay.
You're looking at last year applications, PDPs, some Medicare Advantage plans that were the right fit for the client, aka lowest cost throughout the year, doctors and network, providers, pharmacies, and network that you weren't going to get paid on to write.
Yeah.
So a lot of agents, they went 2 routes. A lot of agents took the route of, I'm going to write this piece of business no matter what. It's the plan that fits them. I'm going to write it. A lot of agents said, I'm not going to write with that. I'm not going to do that. If you want it, I'm going to tell you about it. But if you want it, you're going to enroll yourself. I'm not agent of record.
That was what I did.
Right. And so it's kind of like, what is the value
There was maybe 5 that I wrote because they were just like totally computer illiterate.
Yeah,
but the majority, I did that.
So at what point is it like, where does value outweigh revenue and vice versa? Where does revenue overshadow, like, you know what I mean? Where is that line?
Right. I think like if I was feeling this much, if I was doing this much work constantly, I think I would know.
Yeah.
I think I would hit that point where I was like, it's not worth it for me to make all of these calls.
Yeah.
But I just think I'm in a weird, I don't know, that it's all been happening a lot lately. I don't know. I hope.
And I can also like kind of see, again, this is all coming to my brain, out my mouth as we're talking about it. This is not something I've thought of before. I do think there's also a threshold for like your book of business size.
Oh,
like,
I agree with that.
Woo,
completely.
I touched a thing. Sorry. I made a point and I touched it.
I have been worried about that. And it was honestly, I wanted to talk to you, like what you think, because I'm like right under 500 clients. And I work 15 hours a week.
That's insane.
So
that's insane.
I don't want to get to a point where I start to have bad customer service. But there's only so much I can do in 15 hours a day. And I do have 15 hours I need to go back to sleep.
I hear you.
15 hours a week. And so, yeah, I've been trying to figure out like, what is that threshold? Because like, I can't imagine turning down clients. Like if a financial advisor says, hey, can you help this person? Yes, absolutely. I can't imagine getting to a point of saying no.
Right.
But I don't know.
Yeah.
I'm good.
That's so hard. And I think that's like the point where it's like all these things you're coming across, they help with retention.
Yep.
Which builds revenue.
Right.
They get you referrals because you're going to take care of your people better than anybody else. You're going the extra mile. You're providing value that like enrollment centers, you're not going to get a hold of a call center and they're going to help you overcome IRMA, or they're going to help you like find a drug a drug grant, right? Like that's something that like field agents will do that a call center is not going to, because they are paid based off how many times they answer that phone a day.
Right.
So it's valuable, but there is like, if I was a new agent and I don't have the client base, I'm going to use the word to farm. Like I don't have like, I can't expect to get a ton of referrals and a ton of products out of my current client base. I'm subs 20 clients. You know, what is the value, or where is that line? I think it would be different as far as providing all those extra bells and services and whistles, because I'm not spending that time prospecting, networking, you know, being at places because I'm busy doing that. So it is a bit more of a balance, a bit more of a dance. I think it looks different as you do grow your book of business. It does,
and per individual. So like, let me explain the drug grant things that I've been doing. So there's some new clients who referred to me. They have Anthem right now, but all their doctors are at the university, and university and Anthem are not they're
battling.
They're battling, and so
very
they're not
publicly battling.
They're not in network at our big local hospital as of April 1st. And so they came to me wanting to switch to United Healthcare. I said, absolutely, we can do it. I'm getting their drug lists. He takes tons of medications. He takes 4 inhalers. 3 of the inhalers are specialty tiers, $20,000 a piece.
Damn.
And so 3 different drugs a month.
Nuts.
So he has these 3 drug grants that are through PAN, JAMSON, and he has drug grants through the MU pharmacy. And I was like, I think it's a smart move for you to go to this United Healthcare plan, but I can't comfortably move you to this until I speak to these drug grants and make sure that you changing your insurance won't affect the grants.
Right.
Because he would be liable for $60,000 a month. Like, no.
Well, I have a question about that. How
they're just
with the $2,000 MOOP? Are they not
on the formulary?
They're not. So the drug
They're
plan
specialty
currently
drugs.
is not covering those prescriptions.
None of them.
So specialty drugs, not specialty drugs in the sense of like they're on a tier 4 or tier 5, which are known for the specialty.
Correct. Sorry, did I say specialty tier?
Yeah. Well,
I meant specialty.
I'm saying specialty tier. I'm trying to make sure. So you're saying like they are a medication that is currently not being covered.
Not being covered by any Advantage plan.
Oof. So like the
3 of
2000,
them.
That's nuts.
3 of them. And they have to be shipped from this specialty pharmacy in like coolers.
And they're not a Part B medication.
Correct.
Okay.
Correct. And he's been taking them for like 3 years.
Mm-hmm.
And Anthem's like he had these drug grants. And so I've been having to call these different drug companies. And 2 of them, they were able to talk to me and give me confirmation that it's totally income and asset based.
Yeah, because if Anthem's currently not covering it, I think the part where you'd be concerned is if UHC did cover it.
Well, but what's confusing is I thought I went into it thinking it was going to be income based and that the insurance wasn't going to matter.
Mm-hmm.
But why, when I look at their claims on their Anthem, like it's on there. Anthem's not paying anything.
Well,
but Anthem's on,
you know why
but those drugs are on there.
It's because of mymedicare.gov. It does track the medication. It does track those prescriptions. It is based off claims submitted, but what that means is that the pharmacy's trying to submit those claims to their Part D carrier.
Yeah, because the way I understood from the drug grants is that like they still bill it to the insurance first.
To show that it's not getting covered.
Correct.
Yes.
Yeah.
So it would show up on his, not evidence of coverage, but Part D summary, the quarterly Part D summary.
That, and then
evidence of benefits? What's that called? Anyways, go ahead. Sorry.
The third drug grant company, Jamson, that I called, they wouldn't talk to me like without the member on the line.
Mm-hmm.
And so just all of that, like me having to call these different places, and I have to now coordinate with the client to when we can all be on the phone together.
Mm-hmm.
So like I could have just moved them to United Healthcare and not done any of this.
Right.
But in good faith, I didn't want to be like make that switch, and they have all these drug costs now.
Yeah.
So, which they were totally appreciative for, but like, those situations don't happen all the time.
Yeah, well, and like you're not getting
and
paid
I'm learning
for
from
time.
it. I'm
Yes.
learning all about this new the university, the MU Pharmacy has these drug grant programs that you can apply for, which are awesome, that I learned about that I didn't know. So yeah, I texted you. I was like, "What do you know about PAN?" And Olivia was like, "I've never heard of it."
I don't know her. Never heard of her. And that is, and again, but it's talking about like. There is a line between doing the right and I'm asking hard questions. You and I are always on the same page of like just do the thing. Like just take care at the end of the day, take care of your people.
Right.
And you'll get taken care of.
Mm-hmm.
It's karma, it's putting out good vibes, but it's also referrals, retention, all that stuff.
Yep.
But I think as a business owner, it's a really safe what's it called whenever exercise to kind of ask yourself like how am I going to make the most out of this activity that I'm doing?
For sure.
And asking for the referral, right? Number one.
Yes. Yep.
Or asking about making sure that you're advertising, having them do a what's it called when people say they like you and they put it in writing?
A review.
Testimony. Thank you. A review or testimony is asking for things like that, getting the most bang for your buck, your most mileage. Because at the end of the day, your activities that have to point towards income with that.
Yep.
But just an interesting exercise. Of like, how are you actually like?
And I think I would just like no, like I wouldn't enjoy it. Like if I was constantly doing all of these things.
Yeah.
I think I would understand why some people don't run drug plans.
Mm-hmm.
But no, like this is more of a unique situation.
Mm-hmm. So let's talk about that a little bit more. And I want to address, Christy said, issues agents prospecting and taking my clients during OEP. So just reminding Christy, again, I hate that. Understanding, again, the rules surrounding OEP. Agents are not allowed to prospect using OEP as an election period. Obviously, you can take on new clients using OEP as that election period, but like advertising about it, saying they're still trying to make a change. So that is frustrating, Christy. And if I were you, I'd be talking to your clients. That's why it's so helpful because, again, whenever somebody leaves you as a Medicare Advantage plan and you normally don't find out they left you until after you see the commissions or see your book and they're no longer active on there. Compliantly, you're not allowed to reach out to them and say like, what gives? Because CMS is trying to protect them. But that's why it's so important to have multiple products with them. Because if they still have a cancer plan with you or they have another type of product with you,
they're less likely to leave you.
Well, they're less likely to leave you, but you have grounds to contact them. Yeah. It's not a compliance violation to contact them and talk to them about their coverage because they are an active client with you one way or the other. So
good point.
Always a really good idea. If you have Medicare Advantage clients, have another policy with them so that if they leave, you can call them. But find out what it is. A lot of times we are seeing huge OEP numbers. No shock. I mean, we've been seeing large OEP numbers since the return. About 2 years after the return of OEP, the first couple years of OEP, there wasn't a lot of activity around it at all. But obviously, thanks to the crazy past couple of years that we've had, a ton of activity.
Yep.
For sure. And then Michelle says she's used the Pan Foundation a few times, and will usually
it's disease in combination with medicine. Yeah, it's I'm familiar with the foundation too. What I was trying to figure out is if they change insurances. Because you have to reevaluate all these drug grants. They last for like a 12-month period. And then they reevaluate, make sure your income hasn't changed. So like, what if you change your insurance month 7? Like, will that affect the grant? And so that's what I just want to hear, like a verbal confirmation that nothing will be.
Usually in my experience, when I see these grants working with organizations like Needy Meds,
a
lot of those will say you can't use in your insurance and also use the grant. It's one or the other. It's the same way with coupons. It's the same way with a lot of those things.
Oh.
So even if and again, I don't know specifically for this one, but a lot of them will say we don't care if your insurance covers it or not.
Right.
If you do not use your insurance, then you can use
it's more
this.
of like the discount code, like coupon GoodRx.
Right.
Yeah.
Okay. So I know you and I have kind of, here's the idea, here's the topic, and then let's go down these rabbit holes, right? So here again, it's just kind of the things that we were seeing, and it's definitely you, Kari, but I know a lot of that drug cost. People are so confused around the $2,000 MOOP. They're very confused.
They think it's a deductible.
Yep. Exactly. Or a lot of them are hitting it earlier because they're not taking to an account that they're like on an enhanced medication or enhanced plan versus standard. So they're hitting it earlier than they thought. So I'm getting a lot of questions right now about drug cost plans, and I know agents are spending a lot of time with pharmacists too.
Yep.
Trying to educate them a little bit more about it because they're just as lost as
I think my
else.
most frequent questions about the $2,000 is that people are confused thinking it's a deductible or Medicare sent out that letter about the prescription payment plan and that confused. I got probably 10 calls about that letter because they were like, why do I have to set this up? And I'm like, no.
You don't have to.
You don't have to. It's just a notice.
You can. Yeah. So let's talk about, let me see. The IRMA appeals. I know you're saying like this takes a lot of your time, especially for you. You work with higher opportunity, higher income individuals because of your relationships with the financial planners. So how long, again, from your experience, of course, as we know, IRMA is income-related monthly adjusted amount.
Yep.
Meaning that if somebody, either as an individual or as a married couple, if their tax returns or basically their taxes 2 years prior show that they have a high enough income, they get billed higher for both Part B and Part D. So people can appeal those, just giving some backgrounds based on there's 7 things that
had a life event.
Exactly.
Yep.
One of which would be the most
retirement.
Yeah,
I
retire,
or a work
I don't
reduction.
Make that income.
Yep. And
how long does that take you?
It doesn't take long. It's just usually like, when we have our meeting and we sign everybody up, I tell them, all right, hey, listen, what makes it confusing is when they first get their invoice about their Part B, they don't get the income adjustment first. So I tell people, hey, listen, you're going to get a letter stating $185 is going to come out of your check. Don't believe that.
Yeah.
You're going to get a second letter that follows that says you're subject to an income adjustment. And then sometimes the Part D income adjustment comes in a third letter. I've had so many people who get 3 letters, and so it just gets confusing.
It's really confusing.
And I have so many people that say, well, can we just appeal it now, like ahead of time? Like, no, you have to wait until they determine you have the adjustment. So like we talk about it, but I think there's just so much that's being talked about at that meeting.
It's so overwhelming.
That they forget, oh yeah, I have to appeal this. And so even though I've given them the forms, I'm usually having to tell them again how to fill it out. Mm-hmm. The actual appeal isn't very long. I mean, you just have to put in your 2023 AGI and your estimated 2025.
Yeah.
And then that's really it. But it's just.
What about to process it? How long does it take to process that usually?
I feel like it's about 3 to 4 weeks.
Do most of your people get approved the appeal?
I've never had anybody denied.
That's good to know.
Yep, I've never had anybody denied. And what else was I going to say? Oh, the other thing is a lot of people, like if you're married filing jointly, a lot of people just think, well, oh, I'll fill it out. Mm-hmm. They just need one, but no, you need two.
Yeah.
So they'll sometimes. The husband will fill it out thinking they're good. And then they're like, well, I filled out this application, but she just got a letter.
That,
I'm
like,
like, no,
you individual.
Yes, you have to do two. So.
The other thing I wanted to talk about was client IT issues. This is something that I know we're going to continue to see a lot of. We talk about this a bunch. There's like right now such a divide in the ability to handle technology in Medicare aged individuals.
There's such a divide.
You have your baby boomers who not grew up with technology, but have been working with technology for the last 20
They like to text.
years.
They like to email.
Exactly. Yep. And some of them, like, it's so funny. Like my mom, for example, she's 65, and she's somebody that's like, she'll be 65 this year. It's really funny to see her go through the process of like the mail that she's getting. She'll turn 65 in October. But to see her, like, she can run circles around me in Excel. Like, that woman is a goddess in the sheets. Awesome. Take that for what you will. Yep. She 100% can run circles around me in Excel. But, like, you put her in a website and she's just, like, lost. And she's just like, I don't know. Funny. Like, even, like, her on her phone, my son wants to watch her phone. And she's, like, can't figure it out. How to get YouTube on her phone, right? So it's just, like, just such a huge, like, range of tech savvy. There's no wide stance of, like, this is what the people go through.
And then people, like, 80s, like, I don't have an email. What's an email? Or when they're, like, it's lowercase or capital K, and I'm like, you don't have to capitalize in the email.
Yeah. And it's just and so like kind of what's the number one when you're helping people with their tech? What is it that you're helping them with?
Oh,
would it be like are a lot? Let me ask you it this way, because I'm going to lead you a little bit. Are a lot of your clients using their client or their beneficiary portals like mySSA.gov, mymedicare.gov, carrier insurance portals?
The carrier insurance portals. I did get a lot of questions about when Social Security's like they're getting rid of the 3 logins.
Yeah.
That was confusing. But it's usually the carrier portals because I tell a lot of them, at least the Advantage plans, that they should download the app because you can see all your OTC from there and your rewards, all of that. But a lot of people just can't figure out the login and I get it. Like if you just Google United Healthcare, like
which one?
Yeah. And so it's that, or they forget their passwords as we all do, but they don't know how to just like troubleshoot that easily. And so, I just defer it. I'm like, if you're having technical issues logging in, that is one thing I cannot help you with. You just have to call the customer service number.
Oh, that hurts, right?
So,
well, and that's that's the line, right? Like,
it's the line. There's literally nothing I can do.
That video that Colby I was talking about, he did. My favorite part of that was he was actually going through and like walking up to the doors and talking to his clients. Yeah. And at one point in the video, it turns on to him. He's installing a DVD/VHS player.
Oh my gosh!
And he's just like, oh, they're waiting for their grandkids to come over and do it. I had some time between appointments, so I'm going to install this Blu-ray or whatever it was.
Just last week, I had a client. She was her phone just kept dinging and dinging while we were in the meeting, and she was like, I'm so sorry. I have this group text, and she was like, it's my Bible study friends, and she's like, there's
getting wild in Bible study.
There's 30 different prayer requests every day, and she's like, I'm praying, but I don't want to give these constant alerts. And I was like, you can just silence that particular group thread. And she was like, what?
Life changing.
So, I had her phone. I was like, I showed her how to silence it. And she was like, that was the highlight of the meeting.
That's like the relationship stuff. Though.
Oh, yeah.
Like,
and
again,
she
it's all
literally
about like,
thanked me so much.
It's all about what can you do? That's the question we should always be asking yourselves. It's not, I'm an agent and you're an agent. Let's compete against each other.
Yep.
Let me talk smack on you. It's your competition is the convenient methods of enrollment, right? It is Google.
Yes.
It is call centers and contact centers, right? Because they are more convenient. And the baby boomers value convenience more than any other generation. And and that's not an Olivia statement. That's from, what's that? I always say Deloitte. What is it? Deloitte, thank you. That's Deloitte. She has a friend. This is Sadie. I'm pointing to Sadie. Sadie has very, very smart friends. One of them works at Deloitte research facilities, but they're the ones that came up with that number.
Okay.
Not important. Kind of important.
Deloitte.
Deloitte. It's like Dolitte. And I said Deloitte. Deloitte. I'm still wrong. Okay. Anyways. But that was, again, like, you have to do these things that again, to show what can I do that it's more valuable than convenience.
Silencing her Bible studies.
That's so
notifications.
Cute. That's so cute. That brings me so much joy. All right, guys, that's what we have time for today. Hopefully you enjoyed this more casual conversation between Kari and I, giving you like the real, like, what does an agent go through? Like, I know Kari, again, wildly successful, has 500 clients.
Wildly.
Which
wow.
we need to do an episode of like, how do you systems and process, and like at what point, because you do have a part-time assistant.
I do.
Like, what do you do? Like at 500 clients, I've maxed out my time. But I'm not done growing. I need to grow, but I've maxed out systems. I maxed out resources.
It just so happens my girls will be like in kindergarten next year. And so I'm like, I'm going to have 5 days. They're just going half day. But I'll have 5 days, and I don't know.
What are you gonna do with your time?
I don't know.
So much bread.
So much bread.
So much bread to be made.
I know, and it's like, because I'll talk to like the other guys, and they're like, "Well, are you going to work more?" And I'm like, I don't know if I want to. Mm-hmm. Like, I've been doing good at 15 hours.
Yeah,
so
you
like,
got a pretty sweet gig.
But then I'm gonna have to at some point turn down clients then.
That's true.
So it's just figuring out that balance.
We'll talk about like systems, processes, and resources to where you can't. Let's say you're maxed out on hours, right? There's a lot of people who can't grow because they're maxed out on hours. Yep. You're maxed out on, like, I have my staff. I pay them what I can. I don't know that I can hire more staff. I don't know that I can hire a full-time person. There's that. And then there's, that's the two biggest time.
Right.
Time, man hours of time, whether it's yours or someone else's. We'll talk about that. Ways to grow your book of business without shrinking your wallet.
Let's do it.
I love it.
Help me plan out my future.
You guys, Kari and I won't be here next week because we will be sipping
Next
drinks.
time you see us, we'll be tanner.
I'm going to be
we'll be bronze.
I'm either going to be an artificial tan or red, and there's nothing in between.
Oh, goodness.
And so appreciate you guys. Next week you're going to have, I think, I know Chaylin's going to be gone as well, but I know Sadie and Ben and the cafe crew. I know Clayton is dying to come back and tell you guys what he's been doing these last few months. So we totally miss having him on the show. So stay tuned. And then the week after that, I will actually not be on Cafe again because I will be at Vegas. At Medicarians. So if you're going to be at Medicarians, please reach out. Again, that is my number. Shoot me a text. Would love to meet up with you guys and, talk shop. Drink a coffee or maybe something a little stronger and talk some shop. It is Vegas after all.
It is Vegas.
Awesome. All right, y'all. So aloha, which means hello and goodbye.
And goodbye.
Beautiful. Aloha. Well, until next time, y'all. You have fun,
make money,
and give impeccable
service. Sorry.
Okay. Well, we're gonna go on vacation now. Bye.